Now to a new bill in Lansing that is looking to tackle the issue of a physician-assisted suicide in our state once and for all.
It's an issue that used to dominate the headlines back in the 1990s with the saga of Jack Kevorkian. Rod Maloney is here with us. And Rod, these dying with dignity laws have been picking up across the country.
All across the country, and invoking the name of Dr. Jack is not sitting well with the Democratic senators who are introducing this bill. But the Michigan Catholic Conference believes it fits. However you view it, these bills are likely to cause quite the stir in Lansing.
It's a debate that's existed for 30 years now in Michigan, since Dr. Jack left his first assisted suicide patient in his van. Senator Kevin Hertel of St. Clair Shores isn't on board with that comparison here, though. He calls the bills introduced this week compassionate care.
It really has proven to be safe, effective, meaningful, giving terminally ill patients the comfort and the dignity that I think they deserve.
Michigan Catholic Conference policy advocate Rebecca Mastee puts it much more simply.
Allowing a physician to just prescribe lethal drugs for the purpose of ending their own life is suicide.
Oregon was the first state to allow this back in 1997. 9 other states joined in thereafter, along with Washington, D.C. And here's what these bills enable. Patients must be diagnosed as terminally ill with 6 months to live, request the drug from the patient's own physician, and must administer prescribed medication to him or herself. There will be criminal penalties for violating any of these provisions, either by the patient or the doctor.
It gives somebody the freedom and a choice, and I think most people would want to have that freedom and that choice when faced with a very difficult situation in their life.
We need to provide care and assistance and love and support to individuals as opposed to offering them death.
Well, Senator Hertel chairs the Senate Health Policy Committee. He expects to have hearings on the bills in either January or February. We can expect to hear from the Catholic Conference and a raft of supporters in the disability rights, hospice and palliative care organizations, and poverty rights advocate space, because they believe it is those people who will suffer at the hands of this law.
So now say the law passes, a patient is given the medicine but doesn't use it. What happens?
Well, and that's an interesting point. What happens is that it actually gets turned back to the doctor, or it's supposed to be turned back to the doctor. That's one of the many provisions that are in this thing. Lots of complicating issues, and it's likely that this bill won't look like this by the time that gets to the floor.
Well, actually, a lot of time has passed since that last round of this when it was so topic of conversation years ago. All right, Rod.
Thank you.
Yep.